Have you ever been to the doctor and had your knee tapped with a little hammer? You probably experienced the famous knee-jerk reaction. This is formally known as the patellar reflex or sometimes knee jigger syndrome. It might seem like a simple involuntary twitch, but this reflex plays a crucial role in our everyday movements and balance. Don't worry, it's perfectly normal. This reflex is your body's way of protecting itself from potential injuries. It's a fascinating example of how our nervous system works to keep us upright and steady. In the following sections, we'll delve deeper into the science behind this reflex, debunk some common myths, and explore ways to maintain healthy reflexes. The patellar reflex is a reflex that occurs when the patellar tendon in the knee is stretched. This stretch sends a signal to the spinal cord, which then sends a signal back to the thigh muscle, causing it to contract. This contraction causes the lower leg to extend outwards, resulting in the familiar knee jerk. This reflex is important for maintaining balance and posture. When we stand, walk, or run, our knees are constantly being subjected to small changes in pressure and position. The patellar reflex helps to keep our legs stable and prevents us from falling over. Now that we understand the basics, let's address some common misconceptions surrounding the knee jerk reflex. Myth: a strong knee jerk means you have strong leg muscles. Fact: the strength of your knee jerk reflex is not an indicator of your leg strength. The knee jerk reflex or patellar reflex is actually a measure of how well your nervous system is functioning. It specifically tests the communication between your nerves and spinal cord. Instead, it reflects the sensitivity of your nervous system and the communication between your nerves and spinal cord. This reflex is an automatic response that helps doctors assess the integrity of your nervous pathways. Myth: everyone's knee-jerk reflex is the same. Fact: the strength of the patellar reflex can vary from person to person. This variation is completely normal and can be influenced by several factors. Factors like age, overall health, and even stress levels can influence the intensity of this reflex. For instance, older adults may have a diminished reflex due to age-related changes in their nervous system. Myth: if you don't have a knee-jerk reflex, you have a serious medical condition. Fact: while a consistently absent reflex can indicate a medical issue, it's not always a cause for alarm. Sometimes a lack of reflex can be due to temporary factors. Sometimes factors like muscle tension or even improper positioning during the test can lead to a diminished response. It's important to ensure the test is conducted correctly for accurate results. However, it's always best to consult a doctor if you have concerns about your reflexes. A healthcare professional can provide a thorough evaluation and address any underlying issues. Section 4. Causes of abnormal knee reflexes. Understanding the reasons behind abnormal knee reflexes can help in diagnosing various health conditions. While a certain degree of variation in the patellar reflex is normal, significant changes or abnormalities can sometimes signal underlying health conditions. These variations can be subtle or quite pronounced, depending on the individual and the underlying cause. Let's explore some common causes. Understanding these can provide valuable insights into a person's overall health. Hyperactive reflexes. Exaggerated or overly brisk knee-jerk reactions can be a sign of an overactive nervous system. This heightened response can sometimes be alarming and may require further medical evaluation. This can be associated with certain neurological conditions. Disorders such as multiple sclerosis or spinal cord injuries can lead to hyperactive reflexes. Hypoactive reflexes. A diminished or absent patellar reflex may indicate an underactive nervous system. This lack of response can be concerning and often points to underlying issues. This can be linked to conditions like hypothyroidism or nerve damage. Both of these conditions can significantly impact the body's reflexes and overall nerve function. Age-related changes. As we age, it's natural for our reflexes to become less pronounced. This gradual decline is a normal part of the aging process. This is a normal part of aging and usually doesn't signify a problem. Regular checkups can help monitor these changes and ensure they are within expected ranges. Muscle tension, stress, anxiety, and muscle fatigue can temporarily affect the sensitivity of the patellar reflex. These factors can cause the reflex to be either more pronounced or diminished. This is why relaxation and stress management are important for overall nerve health. Techniques such as deep breathing, meditation, and regular exercise can help maintain healthy reflexes. Section 5. Maintaining healthy reflexes. Just like other aspects of our health, Maintaining healthy reflexes involves adopting a holistic approach that includes both physical and mental well-being. Here are some tips to help you keep your reflexes sharp and responsive. Stretching exercises. Regularly stretching the muscles in your legs, particularly the quadriceps and hamstrings, can help maintain flexibility and improve nerve communication. This is crucial for ensuring that your reflexes remain quick and efficient. Regular physical activity. Engaging in physical activity stimulates blood flow and nerve activity, which can contribute to healthy reflexes. Activities like jogging, cycling, and gym workouts are excellent choices to keep your body and mind in sync. Choose activities you enjoy to make it sustainable. When you enjoy what you're doing, you're more likely to stick with it, making it easier to maintain your reflexes over the long term. Stress management techniques. Chronic stress can negatively impact nerve function. Managing stress is essential for maintaining healthy reflexes. Incorporate stress-reducing activities like meditation, deep breathing, or spending time in nature. These activities can help calm your mind and improve your overall nerve health. Nutritional support. A balanced diet rich in B vitamins, particularly B12, is essential for nerve health. Proper nutrition supports the body's ability to maintain and repair nerve tissues. Consider incorporating foods like leafy greens, eggs, and fortified cereals into your diet. These foods provide the necessary nutrients to support your nervous system and keep your reflexes in top condition. Section 6. When to seek medical advice. While occasional variations in your knee-jerk reflex are usually not a cause for concern, it's crucial to seek medical advice if you experience persistent changes or accompanying symptoms. Consult your doctor if you notice sudden changes in reflex strength, weakness or numbness in your legs, difficulty with balance and coordination, or persistent muscle twitching or spasms. Remember, early detection and timely intervention are key to managing any potential underlying conditions effectively. Section 7. Conclusion: your reflexes, your health. The seemingly simple knee-jerk reflex provides a window into the complex workings of our nervous system. Understanding the factors that influence this reflex and recognizing any significant changes can provide valuable insights into our overall health. By adopting a proactive approach that includes regular exercise, a balanced diet, stress management, and timely medical consultation when needed, we can ensure our reflexes remain healthy and continue to support our everyday movements and well-being.